Medicare has for parts that sound similar, but they do very different jobs. In this video, I'll make it simple. Part A is mainly hospital coverage, Part B is medical coverage, Part D is prescriptions, and Medicare Advantage, also called Part C, is an all-in-one plan offered by private insurers. Start with Original Medicare. Part A helps cover inpatient hospital care. Part B covers doctor visits, outpatient services, tests, and many preventive services. In 2026, the standard Part B premium is $200.90 per month, and the annual Part B deductible is $283 for Part A. One key cost is the inpatient hospital deductible, which is $1,736 per benefit period in 2026. These numbers matter because people often budget monthly premiums and forget deductibles and cost sharing. Now Part D. That's your prescription drug coverage, usually through a standalone drug plan if you stay in Original Medicare. Part D plans vary a lot by zip code, different formularies, different pharmacies, different tiers, and different rules. The big mistake is picking a plan based on premium alone. Instead, you compare your exact medications, your preferred pharmacy, and whether your drugs are on the plan's formulary. Then there's Medicare Advantage, or Part C. Medicare Advantage plans bundle Part A and Part B, and usually include Part D too. They often add extras like dental, vision, hearing, and fitness perks, but the trade-off is usually network rules. So the number one question is not, is Medicare Advantage good? It's, will my doctors, hospitals, and prescriptions still work smoothly under this plan? Here's the enrollment timeline that creates most confusion. Every year, the main Medicare open enrollment, also called the annual enrollment period, runs from October 15th through December 7th. That is when you can switch plans, join a Medicare Advantage plan, drop Medicare Advantage and return to Original Medicare, or change Part D plans. Changes typically take effect January 1st. There's also a separate window called Medicare Advantage Open Enrollment from January 1st through March 31st, but it is only for people already enrolled in a Medicare Advantage plan. During that period, you can switch to another Medicare Advantage plan or drop Medicare Advantage and go back to Original Medicare. Often adding a Part D plan to penalties are the silent budget killer. If you delay Part B without qualifying for a special enrollment situation, Medicare can add a late penalty commonly described as 10% for each full 12-month period you could have had Part B but didn't, and it can last as long as you have Part B. For Part D, the late penalty uses a national base beneficiary premium $38.99 in 2026 multiplied by 1% times the number of full months you went without creditable coverage. So what's the smart checklist before choosing or switching? First, confirm your doctors and hospitals. Second, check your prescriptions and pharmacy. Third, compare total yearly cost, not just the monthly premium. That means premiums plus deductibles plus copays plus the plan's out-of-pocket maximum. And finally, know your deadlines. October 15th to December 7th is the big one, and January 1st to March 31st is a Medicare Advantage only window.